when we're talking about a left on right sacral torsion, we're treating it with the Still-Laughlin functional. First thing again is to always get is the axes. So we gotta stack our axes. So we're going to translate anterior and posterior till we get right on the middle transverse axis. So all of our motion is going to be localized at the level of the PSIS. Then we know we're on the middle transverse axis, which is the axis the sacrum works on. So we've maximized the movement of the sacrum on that axis. Then with a left on right torsion, we have to also activate the right oblique axis. So to do that, you're going to side bend your patient and to see. So when we side bend to the right, I just activated the left oblique axis. So in this case, my thumb dropped down, I got on the right oblique axis. So once I'm on the right oblique axis, then I'm just going to, this time with a left on right, it's rotated left on the right oblique axis. So the sacrum is looking to the left. So this is another case where you're going to load and float the same side. So we're going to load the left ischial tuberosity, so that you want your hand more at the nape of the neck for better control. So then we're going to just side bend a little more to load that ischial tuberosity onto the table. And then we're going to back up just the least bit so that we've got that left SI joint floated. So maximal movement is there. And then you can double check just a little fine tuning to make sure you're still on that oblique axis. And then you're going to add your vector force, thinking again of your hands trying to touch. You're going to load your activating vector force down into that, toward that dysfunctional joint till you feel the tissues start to activate and move. This time I have to load quite a bit of force to get the tissues to activate. I'm going to maintain that. And then there's a little bit of a still point there. Again, still point as in a moment of pause. And then the tissues will again activate, continue unwinding. A lot of times the innominate will kind of pick up a little bit and then it will soften up and just everything will settle down and relax, and then you can recheck the motion test and make sure that you have corrected your dysfunction.